As I said before, we're going to mute everyone. And if you have a question or comment, please type it in the chat. We have a really high volume of attendees today. And so the chat will be your option for making a comment or asking a question. For those of you that are calling in, if you could take a moment, we do want to know who's with us today. Right-click on your name in the participant list and rename yourself so we can identify who is joining us. And then also in the chat, so we don't have time for introductions of a large group like this, if you could type your name and your organization, and feel free to add your pronouns to your introduction. We will have staff monitoring the chat, and the questions will be answered throughout the meeting today. And I see some questions already in the chat. Yes, the PowerPoint presentation will be made available after today's presentation. Next slide, please. So we're going to begin with some information about what our youth are thinking. Next slide, please. So we've been talking to foster youth and also some of our own children and some of the kids, you know, that our children go to school with and so forth. And our young people have a lot to say and a lot of questions about the vaccine. And so, you know, that's the primary reason that we're holding this webinar today, is we want to get to some answers for all of you that are working with the foster youth in the field, or our foster youth yourselves that have joined us.
Yeah, exactly.
So
Thanks. Bye.
One of the primary questions that our foster youth are asking is, who gets to decide if I can get vaccinated? They also want to know, do I have to get the vaccine if I don't want to, but my parents or foster parents want me to? Also, folks expressing, you know, nervousness about getting vaccinated while they're tired of being, you know, cooped up and not being able to do all of their normal activities and hadn't been able to go to school until more recently. That is something that's driving them to want to be vaccinated, but there's still some nervousness around it. And so we're hoping that with a lot of information provided today, some of those questions and just sort of some of the myths will be dispelled and that sort of thing, so that folks will feel less nervous about getting vaccinated. Other youth are asking what the difference between the different types of vaccinations are and what the most common side effects for teenagers who have received the vaccine. Next slide, please. Next slide. So a few last things that we've heard from the field when getting the COVID vaccine. What are the main risks for someone if they have severe allergies? Also, both adults and youth are talking a lot about what the chances are that, you know, someone can contract COVID-19 even after they're fully vaccinated. For teens who've already been vaccinated, will they need a booster shot? There's a lot of, you know, talk in the news, and so our youth are having those questions as well. And how often would that booster shot be necessary? And another very common experience for our youth is what will happen if they don't get vaccinated. There's been, you know, much information throughout the pandemic about reporting that kids don't get as sick or may not die if they do contract the virus. So we're going to hopefully address most of these items with our different presenters today. And, you know, hopefully you'll walk away at the end of the day with a lot of great information. Next slide, please. I think I'll go back. All right, we're going to begin our presentation with Dr. Robert Schechter from CDPH. He's the immunization branch chief. He's going to be providing some general information about the vaccination, and then he's going to turn it over to his colleague, Dr. Naomi Burdock, and she will be providing us some additional, more specific information. So Dr. Schechter, you can begin.
Lori, can you hear me okay?
Yes, we can. Go right ahead.
Great. Good afternoon, everyone. Thank you for the chance to meet, and thank you for all the work you're doing on behalf of foster kids around the state. I just want to talk briefly about COVID vaccines. Next slide, please. Next slide, please. So I'm sure you'll be very familiar with the 3 different types of vaccine that are currently authorized or licensed for use in the United States, from Pfizer, Moderna, and Janssen or Johnson & Johnson. Things have been moving quickly over the last months, so this is just a recap that for foster children in California, the options right now for those under 18 is limited to the Pfizer vaccine, which has received full licensure from the Food and Drug Administration down to age 16, and is under emergency use authorization or EUA status for ages 12 to 15, while Moderna and J&J vaccines are available for those 18 years and older currently. Next slide, please. So just a recap on how effective COVID vaccines have been over the last months in reducing the severity of the pandemic. Next slide, please. These 2 curves with the bumps in them, the top show the number of cases of COVID-19 reported in the state of California, and the bottom one in gray shows deaths related to COVID in California. And you can see through, and then as you go along, you're going month by month through the pandemic, and you can see the different waves of disease over the last year and a half. And up through winter, through the January 1-1 and 3-1, the curves look pretty similar. But for this last Delta wave that we've been through in the summer, in these last couple of months, the blue curve is taller than the gray curve, meaning that the amount of cases has not triggered as high an increase in deaths. And why is that? Next slide, please. Great. This is data from the Centers for Disease Control that came out last Friday, and it shows, you can see cases of COVID in 13 areas of the United States, including Los Angeles County. Cases on the left, hospitalizations on the middle, deaths on the right. The black line in each of the graphs reflects the levels of the outcome of disease, hospitalization, or death in those who are not fully vaccinated, either unvaccinated or partially vaccinated. And the blue line reflects the same outcome in those who are vaccinated, who are fully vaccinated. And you can see that the blue curves are a lot lower than the black curves, the black lines, showing the protection that vaccines are providing against getting sick with COVID, going to the hospital with COVID, or dying from COVID. And that even with the rise in Delta over the last months, even with the rise of Delta leading to cases on the left hand of the prior slide, if you can go back 2 slides, please. Oop. Yikes. The one before, please. So the even with the rise in Delta in July and August, showing the increase in the cases, the increase in the hospitalizations and deaths, and the blue lines have been lower, showing the level of protection vaccine, especially against severe COVID that's leading to hospitalization or death. And then if I can have you go forward 2 slides. The infographic related to that data, that getting vaccinated during the Delta surge has reduced the risk of infection by at least 5 times, hospitalization by 10 to 11 times, and death by 10 to 11 times, even with the contagious Delta variant. Next slide, please. And getting vaccinated against COVID is safe and a lot safer than getting sick with COVID itself. If the next slide indicates. Presenting CDC data comparing the risks to females and males, older adolescents, 16 to 17-year-olds, the risk of COVID disease on the top of each of that. So the number for every million doses of Pfizer vaccine given, how much protection would you get over the first 4 months? And you can see tens of thousands of cases prevented, hundreds of hospitalizations prevented, hundreds of 100 or more of ICU admissions and deaths prevented in a group of a million Californian teens or U.S. teens getting Pfizer vaccine. And then the risk that's been in the newspaper over the last months of mild cases of heart irritation, where teens have had some chest pain and have temporary chest pain for a couple of days, using the number of cases of myocarditis in comparison as sort of the most serious of the risks of the vaccine. To address Lori's questions, some of the questions that the youth that were summarized by Lori, most children have no symptoms after vaccination or the same kind of symptoms that you had after your vaccines, a sore arm, maybe some fever, maybe not, maybe feeling lousy for a couple of days. Those are the common reactions. This myocarditis is, again, a sum in a million for every million doses, and compared to the protection that these vaccines are providing and the hospitalizations and deaths that are being avoided. Next slide, please. I will just mention, to address some of the other questions on Lori's slide, is a foster child with hay fever still able, or food allergies still able to get the vaccine? And the answer is absolutely yes. While there are some very rare allergies to vaccine ingredients that are a reason not to get vaccinated, again, these are extraordinarily uncommon, and nearly all teens are eligible to get vaccinated. So for the 12 to 17-year-olds who are eligible to date, many of them have already been immunized in various settings in the community, either primary care settings or community settings, routine retail pharmacies. And in California, over the spring and summer, over half, 60% or so of adolescents have been fully immunized against COVID, and another 10% are part of the way there with their first dose. However, the benefits are not equally realized, and there are large disparities by economic status, social vulnerability, by race and ethnicity, and by regions within California. One example is on the next slide. Each of these lines represents a social vulnerability or a healthy place index, a combined measurement of socioeconomic status, race, ethnicity, and other factors. And the numbers, the higher number would reflect higher socioeconomic status or wealthier kids on average, and the lower numbers, the poorer kids, or with higher levels of disadvantage. And you can see that actually these are not just the adolescents, these are all ages eligible for vaccination, and that the higher quartiles have higher coverage, 20 to 25% difference between the richest and poorest quartile. Next slide, please. So for the 30% or so of teens, including foster children who haven't been vaccinated yet. Where can they get vaccinated? There are a couple of websites. If their usual source of care, their primary care sources, including community health centers or rural health centers, if they do not have ready access, you can go to the myturnca.gov website on the internet or call to find an appointment. You could go to the federalvaccines.gov to find a source close to you. But right now, I think there's tens of thousands of sites nationwide and many, many thousands of sites statewide, including many retail pharmacies where with ready access to vaccine at this point. Next slide. Just quickly on pregnant women, including pregnant teens. More and more data have come out over the last weeks, reinforcing the safety of immunization against COVID during pregnancy and the absence of any data showing an effect on fertility. And many women have become pregnant since getting vaccinated, and leading to strong recommendations from CDC and national medical groups to protect pregnant women against severe COVID. There have been many pregnant women in California hospitals and ICUs over the last weeks with Delta infections and severe COVID. Next slide, please. Looking ahead to the next weeks and months, the possibility of expanded eligibility and more vaccines available for foster children. The Moderna vaccine is under review down to age 12 years old. The Pfizer vaccine trials in children 5 to 11, at least the word in the press is that data will be available to give to FDA in the next few weeks, leading to the possibility of primary school, elementary school age kids being eligible for vaccine in the next month or two, and followed in the month after that with trial results in children, toddlers and pre-kindergarten children. So a very dynamic situation, and the possibility of more options and broader eligibility by the end of the year into the next year. Next slide, please. Amongst the many resources for your clients and the populations you're serving include the ca.gov website, the Vaccinate All 58 website, and the CDC coronavirus COVID-19 website. And next slide. I think that's the end of my slides, but I'm wondering, Lori, if there's any other questions that were raised by the youth that would be helpful for me to try to address before handing over to Dr. Bardock.
I think we're going to go ahead and continue with Dr. Bardock, and then we have left some time for questions. I haven't seen anything come into the chat yet with additional questions right now, so just hold tight till Dr. Bardock is finished, and then we'll open it up for questions. So thank you, Dr. Schechter. We're now going to turn it over to Dr. Bardock. She's going to give us a little bit more information about what it means to be fully vaccinated and some of the circumstances with that. She's also going to spend some time talking about vaccination and schools, as well as a little bit more depth about the Delta variant. Dr. Bardock, you want to start now? Thank you.
Yeah, thank you so much. Thank you for the invitation and the introduction. Next slide, please. So just briefly to set the stage for who is considered fully vaccinated, and then we'll talk about sort of what the guidance is for what people can do if they're fully vaccinated. And this is just a reminder, everybody, many of you probably know this already, You have to be 2 weeks or more after somebody has received the second dose in a 2-dose series. And for the foster youth, they're authorized for use just for Pfizer, because that's authorized for 12 to 17-year-olds, and that's not, none of the others are yet authorized for that age group. So, and to be clear, as Dr. Schechter said, there's emergency use authorization for 12 to 15, and then 16 above is full FDA approval. So what you do is you look at the first dose, and then you do plus 3 weeks, because you have a 3 weeks in between dose 1 and dose 2. Then you have your second dose, and then 2 weeks after that second dose. So it's a total of 5 weeks from the first dose. And we have a little graphic there showing you what it might have looked like in the first week of August, and then 3 weeks later to get the second dose. And then 2 weeks after that is the red stars, when that person would have been fully vaccinated. Next slide, please. So what can fully vaccinated people do under the guidance, under the public health guidance? They can resume activities that they did prior to the pandemic. They have to follow mandatory provisions in the CDPH's face coverings guidance, particularly for K-12 schools. That's a requirement of indoor masking in the K-12 setting. They are also recommended for anybody who's not in the K-12 setting, everybody who's fully vaccinated, that's adults, that's youth, they're recommended to wear a mask in indoor public settings. It just adds an extra precautionary measure for everybody to reduce the transmission of COVID-19, especially in communities that are seeing high transmission rates because of the Delta variant. Next slide, please. And then they should consider wearing a mask in indoor non-public settings, particularly if they're immunocompromised or at increased risk for severe disease from COVID-19, or if they have someone in their household who is immunocompromised, or increased risk of severe disease, or not fully vaccinated, or not yet eligible for vaccination. So just being thoughtful if you're out and about in non-public settings, also considering wearing a mask in those situations, if there's specific situations that are listed there. And then if they're asymptomatic, they can refrain from quarantining, meaning that they don't have to quarantine if they get exposed to somebody who has suspected or confirmed COVID-19. There is a recommendation for fully vaccinated people to be tested 3 to 5 days after they've been exposed, and then to wear a mask in public indoor settings for 14 days after that exposure. All of this guidance is publicly available, listed, like I pulled it out of what's posted from CDPH guidance, so you guys can find that language, and I can put the link to in the chat later. Next slide, please. So finally, they should follow CDPH and local public health department recommendations regarding isolation or exclusion from high-risk settings if they test positive for SARS-CoV-2, the virus that causes COVID-19, and follow those mandatory requirements from local health departments that sometimes differ a little bit locally, but most of the time, stay home, stay isolated if they're COVID positive. If they're symptomatic, that they should isolate for 10 days after the symptom onset with at least 24 hours of no fever and other symptoms have improved. And if they are without symptoms, they just isolate for 10 days after the date of the positive test. So those are the recommendations for if they actually have an infection, which can happen with fully vaccinated people. We are seeing that some people get vaccinated, get the infection if they're fully vaccinated, but the severity of the illness is really, really, really minimized by having the vaccine. And I'll talk about that a little bit more in one of the upcoming slides. Next slide, please. So what is the school-specific guidance? So K through 12, because it's relevant to our foster youth. One is just to highlight that masks are optional outdoors, required indoors, regardless of vaccination status. Students can stay in school if they're exposed without any additional testing. So that's the same idea that I just went over before, this idea of quarantining. You don't, if you've been exposed and you're fully vaccinated, you don't actually need to stay home. You can actually go to school, you can participate in things. You can stay home you should stay home still with symptoms and get tested if you have symptoms of COVID-19. And then it's not recommended for those who are fully vaccinated to participate in the screening testing programs. For example, like LAUSD has ongoing weekly testing programs and sorry, LAUSD actually is requiring people who are fully vaccinated, but throughout the rest of the state, there's no recommendation that people have to participate. So, so I starred the things that are sort of things that can really change how people participate in school if they are fully vaccinated. So things to highlight to youth that, you know, how does school change for them? Is that they can stay in school if they're exposed and they're not participating, they don't need to participate in a screening testing program. And that's not true for unvaccinated people. Next slide, please. So this is just highlighting sort of what we've been helping to message to people about youth vaccines. They provide the protection necessary for students to get back to enjoying the things they love the most. This is definitely messages that youth have said, oh my God, this is what is important to them and meaningful to them, and it includes school sports, clubs, social events. The new school year is here. It's never too late to start getting vaccinated. Many youth got vaccinated already, but we're still only at about 50% in the state. So it's never too late to start, and sort of supporting people to get that done. It protects them, it protects the people they're with. Next slide, please. And then this is just a highlight for your context. There are people talking about mandates. So a local mandate was just passed in LAUSD for vaccination, actually. So COVID vaccinations are required unless they have an exemption. And there's a couple of specific exemptions listed by LAUSD for all eligible LAUSD students by ages 12 and older by Monday, January 10th of the coming year. Next slide. And then this is just to give you guys a little bit of context also for the schools conversation. This is, you know, I wear a hat as one of the leadership roles in the state schools team. So this is a map of school closures around the country. And I think it's really helpful to highlight that California has very few school closures this year. And partly that's likely due to masking requirements, and also high rates of vaccination really are helping there. You can see in many other parts of the country that are having many more school closures, part of it is lower rates of vaccination and not having that masking requirement. So the vaccines are really a key piece of how we're keeping schools successful and how we're keeping our youth safe. Next slide, please. And then just to give you guys a little bit of context for where do vaccines kind of fit in how we keep our schools safe, and that school environment a safe environment. If you think about how does virus sort of spread through schools, what would that look like? Step one, virus has to be in our communities, right? So the SARS-CoV-2 virus has to sort of be in our community. Step two, the virus has to come onto the school campus. Step three, there has to be in-school transmission. This is a key piece of what we're doing to really try and prevent schools to be a place where people catch COVID or bring it home to their family members. It's that in-school transmission is a really core piece. And then the last piece is step four, there's out-of-school transmission. Next slide, please. So the tools we have at our disposal to create those layers that we're using include vaccines, both in step one and step four. Virus in the community comes down a lot if we have people vaccinated, and it comes down, and the risk of it being passed to somebody in the community, if that person is vaccinated, the risk of them getting it is also really brought down. So that's a really important wraparound safety layer that the vaccines provide. They decrease the amount of COVID in the community, and therefore it's much less likely to come onto our campuses or to get passed on our campuses. Next slide. And some people like to see this in the Swiss, what they call the Swiss cheese model, which I think is a helpful model, which is that people talk about these layers, and it's because there is no one solid absolute layer that's like a block for every single viral particle in a school-based setting. So there's always going to be one layer needs to be mixed with another layer, and it's the layered approach that keeps schools safe. Because if you have Swiss cheese, there's a hole in one slice, but you have another slice that has a hole in a different place, then the virus can't get through. So that's what this graphic is showing, and it's the themes that I already highlighted: vaccination, 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 testing, and when you're sick, stay home, masking, and improving air quality. Next slide. And then it's a really hot topic. How have things changed with the Delta variant? So just a few things for people to know. One is question of transmissibility. We do know that Delta is 2 times more contagious as the previous variants, and it's part of what's leading to our current surge in infections. There's another question, what about virulence? Meaning, is it a worse virus? Does it make people more sick than the prior variant? And we're still learning about it, but right now there's no sign that's really showing us that children are more likely to have severe disease with Delta compared to the prior variant. We are continuing to watch that data, but we do also know that because Delta has increased transmissibility, there are more cases of all types, including the cases in kids and including cases with severe symptoms in adults. And the unvaccinated people are more likely to have severe symptoms. That's mostly what we're seeing in the adult population. We're not seeing kids with very severe symptoms compared to the prior variant. We're not seeing a big difference there. Vaccine effectiveness, vaccines are still very effective against Delta. Less than 1% of vaccinated people experience what's called a breakthrough infection, where you're vaccinated but you still have the infection. But it's helpful to remember, if you know 100 people who have been vaccinated, you are likely to know someone. So you might have some anecdotal experience of saying, yes, I know people who have had breakthrough infections, but there's less than 0.005% of COVID hospitalizations with vaccinated people. And unvaccinated people, as Dr. Schechter pointed out, are much more likely to get COVID. And then the last thing to say, the breakthrough infections actually appear to be infectious for a shorter period of time, meaning they don't pass it on as easily. So again, that vaccine creates this protective layer even for the people around you. Next slide, please. And then just to highlight a little bit about the vaccine school piece, as Dr. Schechter pointed out, there's authorization for younger ages expected potentially by late fall. They're even talking about maybe late October. There are a lot of pieces that the state is working on to support schools or to support youth, in particular in the school setting. So school located clinics, requesting mobile and pop-up clinics. Schools can really participate either doing that themselves or having a pharmacy come in and do a school located clinic. Next slide, please. And then this is just a resource for schools who are interested in participating, and so you can pass on to you guys in this group. If you want to pass on this information, schools can participate in clinics. Next slide. And then finally, just to let people know about, we have a schools hub that gives a lot of information both about vaccines and also about schools more broadly in COVID. It has a parent page, which is also just good for community, for any questions that are coming up for folks, a parent page both in English and in Spanish with a lot of great resources. And the URL is right there at the bottom of the page. And I think that's the end of my slide deck. Thank you so much for the invitation, and happy to take questions later or now, whichever makes sense.
All right, thank you so much. We have had some questions come in through the chat during your presentation. So we're going to have Ricky House is going to read those questions to you. And if you and Dr. Schechter just want to, popcorn the questions, whoever would like to answer, just go ahead and provide your answer as she reads them. Ricky, go ahead.
Wonderful. Thanks, Lori. So I do want to say I've seen some responses in the chat already, but I'll go ahead and read through just to give voice to the great questions that have come in so far. So the first question that I see is, how would you respond to someone who is apprehensive about the emergency authorization process?
Some of the talking points. Sure. Some of the talking points would be that while the vaccines process happened quickly, there were not shortcuts in the clinical trials that were undertaken in terms of the size and the rigor, how carefully the clinical trials were conducted, and that since those initial large trials were conducted, there literally have been tens to hundreds of millions of doses of these vaccines given over the last months with very close scrutiny by FDA and CDC and others on the safety of these vaccines. Unprecedented attention in care and in monitoring the safety of these diseases, safety of the vaccines rather. So to the extent that that there have not been shortcuts made, no corners cut in getting the vaccines initially available, and then extensive experience with the vaccines over the last months may help with reassurance, but I appreciate that many parents and guardians are still ambivalent or concerned about the novelty of the vaccines.
Mm-hmm. Yeah, and I'll just add, over 7 million doses have been given to adolescents throughout the whole country, and so we are watching it very, very closely. But as Dr. Schechter said, lots and lots of experience there. Probably more experience than almost any vaccine, certainly within this short period of time of it being available. So I think that's also potentially helpful. And the other thing is sometimes people feel like, oh, it got developed so quickly, but the technology for this vaccine was actually developed over the past 10 years. And it's the kind of technology that is able to be utilized quickly, but it's been developed over a long period of time. So those are the other things that sometimes come up as concerns for folks.
Thanks so much. So another question I see here is that some are talking about only 1 dose for smaller children. There's a question mark behind that. And then over 12, but small in stature. Another question mark.
So it's likely, we'll have more data in a few weeks, but it's likely that the doses for children younger than 12 years will be smaller volume or lower doses. But it will likely to be the same number of doses that for the Pfizer and Moderna doses that you'll want to have that second dose to help the immune system develop as much protection as possible. So I don't think there'll be a fewer number of doses, but the amount for the younger kids may be smaller, and for a child with short stature or otherwise lower weight, lower than average weight, the recommendation is age-based rather than weight-based, and the consequences of a smaller teen getting a full adult dose, would not expect the chances of minor reactions being any higher or of any additional potential harm to the child or the teen.
Thanks. Before we get to the next question, I just wanted to jump in, and we're seeing a lot of great questions come into the chat. And if they are things that are possibly going to be covered later in our presentation, or that we can hold to the end because they're on a different topic, we're going to do so. The doctors have a limited amount of time with us today, so we're going to prioritize their questions for right now, and then we'll have another question and answer period at the end. So go ahead, Ricky.
Great. Thanks, Lori. So the next question here is, how effective are the rapid tests that you can purchase at the drugstores?
And I can probably answer that, Rob, if you want. They're relatively good. The way that you think about a test is, does it tell you how good is it at detecting the infection when you have it, and then how good is it at telling you that you don't have it if you really don't have it? So the first one is called sensitivity. The second one is specificity. It tends to be that they're very good at telling you that you don't have it when you don't have it. Their ability to say you definitely have it if you definitely have it is slightly less perfect. So So I think if you get what's called a negative answer, meaning you don't have it, you can feel really good about that. If you are looking to see, like, if you have a positive answer, if you have a positive answer, you can feel really confident that that is probably a real answer. If you have a negative answer, there's still some small possibility that you might still have COVID, but I would definitely say that it's still, there are people who are still using them and getting pretty useful information that's usable. I will say it's not always usable for like an official test, but if you yourself are just trying to figure out the answer of whether or not somebody has COVID in the household, then they can be helpful for people.
Great. Another question here is, should minors that are vaccinated stay at home from school to quarantine if there is active COVID in their home?
So if the minor is fully vaccinated, they do not need to quarantine if they've been exposed, even if it's an exposure at home, as long as they're asymptomatic. And they should get the guidance is to get tested within 3 to 5 days after the exposure.
I have another question here about where can I find a good resource or statistics on adverse vaccine reactions in children under 18?
Dr. Schechter, you might have a better answer than I do. There's definitely some studies that have been coming out. I haven't seen like a dashboard that has it as an ongoing reporting mechanism, but so you kind of have to look at the literature, the published sort of scientific literature.
There's between the CDC website and the information from the folks who make the vaccine, there's information specifically on the rates of fever and sore arms and muscle aches in or more serious rare reactions in teens. And I'll try to send some of those links to Lori to share.
Great. So as Lori mentioned, there are wonderful questions in the chat that we're going to hold until the later portion of our presentation, and some of the questions may even be answered. I have one more question that may be appropriate for CDPH while we still have you all, but if not, I'm sure that CDSS and later in the presentation we can address it. But the question is any data being collected so that the state knows at an aggregate level or disaggregated by county what percentage of eligible foster youth are vaccinated? I'm not sure if that data is being collected at this time.
We don't have it at the immunization program. I'm not sure if it's being collected by agencies or centers or facility for group facilities.
What I can tell you is that I don't believe at the state level we're collecting that information. That's one of those things that particular counties might be doing. But that's something we can follow up on and get some more information for you and do it, blast it out via email after the presentation.
So 3 more questions did just drop into the chat. I just want to be mindful of the time for our CDPH folks. Do you have a little bit more time to answer a few more questions, or should we move forward? What works best?
I have time for a few questions.
Okay, great. So a question I have here is, what is the protocol for youth that have received 1 dose and then test positive for COVID before receiving the 2nd dose?
So
They
those
would still be recommended to.
Go ahead, Rob.
Oh, I was going to answer the sort of the immunization side as opposed to isolation or attendance side. They would be recommended to complete their 2nd dose after they get over the acute symptoms of their COVID infection.
Yeah, and in terms of how they would be, what the guidance would be about what they would do, protocol, they would be considered not fully vaccinated, unvaccinated. So any recommendations for fully vaccinated wouldn't apply to them. until they're after that, until they're in that period after they've had their second dose, and there's been 2 weeks that have gone by. So it's 5 weeks after their first dose until they're considered fully vaccinated, and all that guidance applies to them as fully vaccinated. And I just put the fully vaccinated guidance in the chat for somebody who was asking a question or clarification about it. And I always find it's helpful to have the actual document, so I put that link in there.
Great. So it sounds like that link helps to answer the question of, is it true that asymptomatic fully vaccinated people? Okay, great. All right, so we'll move to the next question, which is, can you address natural immunity from previous exposure to the virus and what we know scientifically?
So the information we have.
Before they, yeah, I've been doing it.
Go ahead. I'm sorry about that.
The information. Immunity after. So I'll just start out by saying that teens or adults who have had prior infections are still recommended to get vaccinated because the protection after infection can be quite variable, and that protection becomes much stronger. What we've learned over the last months, that protection becomes a lot stronger after immunization, including against Delta variant and other variants. Additional information from the Eastern United States that the risk of ending up with a hospitalized for a second infection, being reinfected by COVID is over twice as high for those who haven't been vaccinated compared to someone who's been infected and then vaccinated. So the level of protection after infection is inconsistent and becomes much stronger after immunization, leading to the recommendation, the current recommendation for still get vaccinated even if you've tested positive over the last year and a half.
One more question. You know what, actually the next question I think we're going to hold for a later section. Great. I think we've covered all the questions that I've seen come in for CDPH. So if I'm missing anyone else can jump in, but otherwise we really appreciate your time and the information you provided, and I'll pass that back to Lori.
No problem. Thank you so much. Take care.
All of the information that you provided was very valuable. We will, scroll through all of the questions and can get back to you. We'll reach out if there's additional questions that did get answered so that we can provide those to our audience at a later time. So again, thank you so much for being with us today, and have a great afternoon. All right, next slide, please. All right, I'd like to introduce Rebecca Gudemont. She's an attorney with the National Center for Youth Law, and she's going to spend a little bit of time talking to us about consent and who can consent for medical treatment for foster youth in general. I've already seen several questions come into the chat about this, so take it away, Rebecca.
Thank you, Lori. And yes, thanks so much for setting me up, folks, with your questions in the chat. Good afternoon. Again, I'm Rebecca Gudemont, and I'm an attorney and senior director of health at the National Center for Youth Law, also known as NCLE. An important component of our work at NCLE is to facilitate access to healthcare for youth in different systems. And as part of that work, we create tools to address common legal questions that, if left unanswered, can sometimes become a barrier to care. So consent and who can consent to care for a minor. Actually, if you can go back a slide for a second, I don't want to distract people with this slide quite yet. Back to the intro. Thank you. I'll let you know when I'm ready. Thanks. So who can consent to care is a real common source of confusion, particularly for young folks in systems. So we created a 4-page grid to help answer the legal question, who can consent to medical treatment for minors in foster care? And I'm actually gonna, in the chat, send you that link where the next slides show you that grid, but it can be helpful if you wanna look at it yourself. So as I said, we'll walk through this grid and set the parameters in answering that question, who can consent for vaccines for youth under California law. But before I get into the details, I want to make 4 large points. These are the big picture things that are important to walk away from if you don't remember details. First, I'm presenting on consent law when we're talking about healthcare for minors. Minors are youth younger than age 18. Once a youth turns 18, they can consent for their own healthcare, even if they're still in the foster care system as a non-minor dependent, barring very rare exceptions for youth with significant disabilities. So 18 or older, youth consents. Younger than 18, we're going to look at the chart and tell you who has what the options are. Point 2, even if you don't remember all the details I'm about to present, the important thing to take away is that in almost all cases, there are multiple people or multiple mechanisms within the law to obtain consent for different kinds of healthcare, and that includes vaccines. The law was created this way with the understanding that youth and families in the child welfare system are in many different places, stages of their case, situations, different medical needs, and they were trying to create some flexibility to ensure, again, that consent wouldn't be a barrier to care. Third point, this chart presents the consent to healthcare rules based on where a youth and family are in their child welfare case. As I said, there are often more than one option, but what you will see is that in almost all situations, the original bio-parent or legal guardian remains one of the default options to provide healthcare consent unless that right has been explicitly removed. This sometimes surprises people, but the first goal when a child's removed from their parents' care is reunification, right? And to that end, the law supports keeping parents engaged in their child's upbringing. So even as I present the options, take note and don't be surprised when you see me continue to refer back to parent or legal guardian. The fourth point, and perhaps the most important, California law gives youth in foster care the right to participate in decisions about their health care. It's part of the Healthcare Bill of Rights. So even if a minor does not have a specific right to consent to a vaccine on their own, their assent and their participation and their questions and concerns are an important part of the process. And we'll talk a little bit more about that in a second. But now if you could move to the next slide, please. Thank you. All right, so this slide is a lot of colors and words. So let me give you a little grounding. This is a cross section of the grid that I sent the link on. The grid is laid out with the minor's custody or placement situation along the x-axis. So you see that first orange column here lays out different custody scenarios or sort of where we are in the case. The type of healthcare a minor might need is across the y-axis, or that orange row at the top. On this slide, we're just seeing a sliver of the chart. We're seeing a column for what is called emergency care and a column for what is called ordinary medical and dental care. For purposes of today, because we're talking about vaccines, we're focusing in that ordinary care column. So why am I calling this ordinary care? Because the law makes a distinction between ordinary care and general care. Ordinary care is the kind of care we need for annual physicals, the care to enroll in schools, get x-rays, and critically, it specifically names immunizations as something that is considered ordinary care. So that's why we're going to focus in that column. Okay, so who can consent to ordinary care depends in large part on the custody situation. So if you'll see sort of in that orange column, our first box says temporary custody. If a child's been taken into temporary custody by child welfare, but a petition has not yet been filed to declare them a dependent, the parent or legal guardian still is the default person who consents to vaccines. That said, there are situations in which a social worker may be able to consent to care. Critically, though, you'll see in the, and it may be hard to read on this slide, but you can see it if you open the link, before a social worker consent, there must be notice to a parent and an opportunity for a parent to object. So there's some process involved. It's not like a worker could simply just take someone and consent for care without. All right, the second scenario you see on this slide is when a minor's been declared a dependent by the court, but physical custody remains with the parent. Again, in this case, the parent is maintaining their consent rights unless the court order. I'm not sure if others are hearing that.
Yeah, we're.
Well, that was exciting. Okay, I'm going to keep going while it's quiet. Okay, so the second scenario, minor's been declared a dependent, but physical custody remains with the parent. In that case, again, the parent is the default person to consent unless there is a court order specifically limiting the parent's right to consent to healthcare. The court also can authorize healthcare for a minor if there is a written recommendation from a healthcare provider and after due notice to parents. And then the social worker also can consent. So parent is sort of, there's no barriers, you can consent. Court and social worker may be able to, but there's some process involved. All right, next slide. All right, so this next section, and I see that some folks are still having trouble seeing slides. I sent in the chat a link to the full chart we're looking at. So if you're able to pull that chart up, you can find a column called ordinary medical care, and we're walking through that part of the chart right now. So this slide describes consent for youth who've been declared dependents and physical custody has been removed from their biological parents or their legal guardian. And this really covers the bulk of youth we have in foster care. They might be living with a resource family parent or in an STRTP. So who are the go-to folks to consent? And I saw this question come up a number of times. The go-to folks for consent to ordinary medical care are the parent or the licensed caregiver. So parent, bio parent can still consent unless the court has limited that right. It would be in sort of the court paperwork. But in addition, California law explicitly authorizes that licensed caregiver to consent to ordinary care, including immunizations, if the minor's been placed in their care by the juvenile court. There's no obligation to provide due notice to parents before the caregiver seeks this ordinary care on behalf of the minor. There's no obligation to obtain social worker or court permission. So both the licensed caregiver can proceed without any hurdles. And really this was set up to streamline access to general health care for young people and ensure consent isn't a barrier. So again, both the bio parent and the licensed caregiver could potentially consent. But what if the caregiver knows that a parent explicitly disapproves of a specific healthcare service, such as a vaccine? Or what if the caregiver refuses certain healthcare and a parent can't be found? What if the youth is seeking out certain care? As this chart notes, there are other options for consent, and that's sort of in the middle of this chart. First, again, there is a mechanism for social workers to consent if the court has issued an order giving the social worker that authority. And the court cannot issue such an order until there's been notice to a parent and there's been a finding that the parent is not willing or capable of authorizing care. Another option is the court itself. The court can issue an order directly authorizing specific health care if there is a written recommendation for that care from a health provider and the court finds there's not a parent capable or willing to authorize care. And again, parents have been given due notice so that they can participate in this hearing. Now, another component of this is the youth. As noted up front, one of the names that you don't see in this chart is the young person. because unemancipated minors do not have the right to consent to ordinary care on their own behalf. However, as I stated earlier as well, the Foster Care Bill of Rights does give minors the right to participate in healthcare decisions made on their behalf and gives them the right to provide input to the court if they wish to be free of the administration of medication. So while they may not have the right to consent to go on their own to get a vaccine and consent on their own behalf, they do have the right to object to healthcare and to ask for due process, or to ask for their voice to be heard if they want the vaccine and are not able to access it because nobody is consenting for them. And critically, this is all something that would occur in consultation with their attorney because they have the right to bring this information to the court. All right, next slide. So this, we just wanted to note that in that grid, you'll also see on this final page a line that says, can a licensed caregiver consent? Can a relative caregiver consent? So we tried to make sure that all of the different custody situations would be addressed on this chart. This isn't substantially different information than we just presented, but just wanted to explain sort of what you see in the chart. And that's it. In some ways, the law is really pretty straightforward. In most dependency cases, a parent or licensed foster caregiver can consent to vaccines on behalf of a minor in their care without any additional process to need to get it approved, going to the court, etc. However, it is important to account for the youth's position. And if there are differences of opinion between parents and caregivers or the adults and the youth, the law has created a mechanism and process to use the courts and has given the court the authority to authorize or deny healthcare. So easier said than done, right? It's pretty black and white, but that doesn't make application easy. And so that's where I think the next set of presentations will get into what is it, how does this actually work in practice? And that's it.
Thank you so much, Rebecca. We're going to go ahead and have Karis do her presentation, and then we'll probably go to some questions from both of you right after that. So I'd like to now introduce Karis Daggs. She's an attorney with the Judicial Council, Center for Families of Children in the Courts. And she's going to be giving us some best practice information for our eligible foster youth ages 12 to 17 about the vaccine. Karis, go right ahead.
Hi, good afternoon. As Lori said, I'm Karis. I work for the Judicial Council Center for Families, Children in the Courts. And I'm just going to go over some best practices as decisions are made about whether or not the youth should get vaccinated. I just want to preface this next phase of the discussion by first saying that I know we've been speaking a lot about youth's physical health, but I also think that this might be an important opportunity to check in with the youth to see how they're doing mentally and emotionally. We know that a lot of foster youth do have fears and anxieties, one around getting COVID, but also around getting vaccinated. So it's important to use this as an opportunity to check in with them and to also connect them with mental health services where needed. So we can go and move to the next slide. So youth engagement and well-being. As Rebecca was hinting at in the previous portion of our webinar, you do want to engage youth in the decision-making process. Under the Foster Care Bill of Rights, we know that youth have a right to participate in decisions regarding their healthcare. So this is not only best practice, but it is also what the law says. So it's important that as these discussions open up and decisions are made, that the youth is engaged and that they're given an opportunity to voice concerns. So some youth may have fears and anxieties about catching COVID or about getting the vaccine, and it's important to connect them with the necessary resources and give them people who can answer their questions so that it's an informed process. Although youth cannot solely make the decision on their own. They do have a right to participate. So you also want to consider the youth's physical and mental health needs. As far as their physical health needs go, depending on how long the youth has been in care, it's important to make sure that they're vetted to ensure that they won't have a negative reaction to the vaccine if that is ultimately the decision that is reached. In the next slide, we will go over who has rights to access their health information, but it's just important to be mindful of that. There's a diversity of youth that are represented in the foster care system, and so we just don't want to assume that everyone is going to be physically able to get the vaccine. Some youth may have had allergic reactions in the past. We don't know. It may not be a high percentage, but it's just important to be mindful of that. And then in terms of the youth's mental health needs, you could have a situation where a youth may be physically able to get the vaccine. There's nothing that would indicate they have risk factors for having a negative reaction to the vaccine. But for example, some of you probably already know this, you may have youth that have severe anxiety. And so it's just something that you want to take into consideration and to connect them with their mental health providers to help them be able to engage the process. And if it ends up being that the decision is that they get vaccinated, you just want to make sure that they have resources to help walk them through that process. So you can connect them with necessary providers if needed. This would be social workers, their therapists, doctors if they want to answer questions about whether or not they think they may be at risk of, like I said before, having an adverse reaction. And then of course, their attorney. They do have legal rights. And so as the discussions and decisions are made around vaccination, if they're unable to come to an agreement, it's important that they are connected with their attorneys who can decide what is the best legal resource or recourse to pursue their rights. And I would just emphasize that, court, that's probably like the last extreme in terms of working out and reaching a decision around vaccinations. But there are other processes that might be more effective to facilitate discussions and resolve disagreements. Like let's say it's between the foster youth and the caregiver or foster youth and their parent. It's important to utilize whether it's the team decision meeting or the child and family team meeting. And then lastly, the court to help resolve those disagreements. And again, we just want to recognize foster youth's rights. Under the Foster Care Bill of Rights, they have the right to receive medical services. They have the right to participate in decisions regarding their health. And then they also have the right to be free from medication, except in emergency situations. So it's just important that the foster youth themselves are aware of their rights and that they are also respected. And then we want to be sensitive to the heightened stress factors experienced by foster youth during the pandemic. We know that the pandemic has been stressful on all of us, but even more so on youth, and then youth in particular in foster care have undergone extra challenges because they've been separated from their families during this time. So it's just important to be mindful to that and give allowances to them that they're able to express their concerns and apprehensions either way about getting vaccinated. And then lastly, you want to encourage the youth to contact their legal counsel for additional information. And like I said before, that could be in the scenario where they're unable to reach an agreement about getting vaccinated, or it could also be in a situation where maybe the youth is attending one of the unified school districts that are requiring mandating vaccination. So their legal counsel may be able to provide information or other legal resources that could help them with their rights around that, whether it's going to be getting an exemption, or if it would be that they're going to do an alternative curriculum such as independent studies or a home-based curriculum. So we could go ahead and move to the next slide. So as I was mentioning earlier, it is important to take into consideration the youth's physical health needs. And so an important part of that is having access to foster youth's health information. So some things that can aid And that would be the case plan should include a summary of youth health information. This could be past health problems, immunizations, or medications. Caregivers should also have access to the health summary. And then also, I just want to note that the Health Insurance Portability and Accountability Act of 1996, HIPAA, and the California Confidentiality of Medical Information allow health providers to disclose medical information to caregivers with some limited exceptions. So that could also help facilitate discussions and help the foster youth with any concerns they may have or anxieties they may have about getting the vaccine. Their health provider will be able to go over that information with whether it's their parent or their caregiver and the foster youth. And parents and legal guardians also have access to youth health information unless this is limited by the court. And then we can move to the next slide. So I also think this is just sort of like a general housekeeping note, and I'm sure most of you are all aware of this, but as the discussions and decisions are made about it's important to limit disclosure of youth health information only to those who are authorized to receive the information. I imagine that as some youth sort of discuss their concerns about getting vaccinated, they might reveal other health conditions that they have. And so it's just important to be mindful of that. And then you also want to just maintain confidentiality of information, including discussions at the child and family team meetings. So that is, I believe, the last slide for me. And I believe later on in the presentation, we'll walk through scenarios of questions, specific hypotheticals of what to do when there's disagreements.
Yes, we're definitely going to get to that. Thank you so much, Karis. We're going to pause now and have Rebecca and yourself take a few of the questions that are specific to your presentations. So we're going to do that for just about maybe no more than 10 minutes, and then we'll move on. So Ricky, do you want to read off a few that have been specific to Rebecca and Karis's presentations, and they can just answer as appropriate?
Absolutely. So the first question that came through is, how does it work when a youth's parents are deceased? Does the consent need to come from the assigned PO or their attorney?
So if this is, sorry, this is Rebecca. If this is a young person who has been placed with a licensed caregiver or with a relative through the court, then that licensed caregiver or relative may be able to consent. If parents have deceased, I imagine if for some reason they're not in that kind of placement, the court will have issued some sort of order granting that sort of the legal right to consent to healthcare to another person. But worst case scenario, there are those mechanisms in the law that allow the court to either directly authorize care themselves or to authorize a probation officer or social worker to consent on their behalf.
Hi, this is Laura Rivas with Kern County Probation. So I asked that question, and so with COVID, we have youth that want the vaccine, but there is no available parent. There are care vested youth. The current orders that we have are for just medical care. Is there a separate one that's specific for COVID?
The COVID vaccine falls into the general category of medical care.
So it would be it would fall into that general. So then wherever they're either the PO or the home that they're in can consent for them is what I'm understanding.
If they've been placed there through the court. And I will note for folks who are in probation, we actually have a separate chart that specifically that sort of looks very similar to the one we did for foster youth that addresses consent for youth who are under probation custody. A lot of the same rules, but if just because some of the different placement options are different, there's a couple other consent rules that are highlighted on that chart.
Okay, if possible, could you send that to us, please?
I will try to send the link right now.
Thank you so much.
Great. And as a reminder, the dependency custody that Rebecca went over earlier is available in the chat. You may have to scroll up a little bit to find it, but it has been dropped in. So I think that this has been touched on a little bit as well, but I'll go ahead and put voice to it. So the question is, do the same consent rules apply for COVID testing?
The key again is that definition of medical care, and medical care includes diagnosis as well, which would include testing, as well as treatment for care or preventive health care.
There were also some links dropped in about information about vaccinating teens, including safety information. So there are a few links that may be good to check out as well for those asking that question. Scrolling through to see here. I think, you know what, I think we've hit most of the questions. We do have a question here of similar, I think, to what's just been discussed, but the question is, does this apply to children 12 through 15 years old under EAU?
And so if I'm understanding correctly, the question is, even though this is because this is emergency approval, is there somehow different rules for it? And nothing in the state law or guidance suggests that emergency approval from the FDA should be treated differently. So it would apply to 12 and older.
Another clarifying question just came through, asking do COVID vaccines fall under all other general care or ordinary medical and dental care?
The interpretation is that the vaccine falls under ordinary medical and dental care because the law explicitly calls out immunizations as part of ordinary medical care.
Wonderful. And there's one more question that came in. Let's see. I'll just read it out loud, and if I haven't been able to screen it yet, so if it's one that we can save for later, just let me know, but I'll read it out loud for all of us. So the question or the statement is just confirming, if there's a disagreement between the foster parent and the parent post-disposition hearing regarding giving a foster youth a vaccine, is best practice to go before the court to seek authorization?
I can take this one. I think the best practice would be to try to resolve it informally first, whether that's through a CFT meeting. And then if that was not successful, I would refer the parent to their attorney as well. And then that attorney could decide whether or not it should be handled through the court. But the court would be the one that would ultimately issue the decision.
All right, so I think we've addressed most of the questions, if not all, on the last few presentations. Thank you so much. We're going to go ahead. We've got a little bit more presentation information, and then we will have a few minutes for additional questions at the end. So can I get the next slide, please? Okay, as I told you at the beginning, I'm Lori Fuller from the Permanency Policy Bureau here at CDSS. I'm going to be turning it over now to several members of my team so that they can do some presentation on the guidance that has been issued by CDSS, as well as going over those scenarios that we mentioned earlier. So I'm going to turn it over to Jennifer Snar, who is the manager of the Placement Services and Support Unit, and also Ricky House, who's a program analyst within that unit, and she's been on for most of this hosting our questions. And then we'll also hear from Jennifer Messerschmidt, who's another program analyst within the Placement Services Support Unit. I think, Ricky, you're up next.
Great, thanks, Lori. So we'll go ahead and go to the next slide. So what I'm going to do today is I'm just go over some of the guidance that's already been issued. Yes, so information notice I-3421 and I-4221 provide COVID-19 vaccination eligibility guidance for minor foster youth. So it's important to note that ACN I-4221 supersedes ACN I-3421 by lowering the eligibility from foster youth age 16 and older to foster youth 12 years of age and older. Going on to the next slide. So the information that I'm going to share on the next two slides is from ACN I-4221, which is the most up-to-date ACN that speaks to the 12 years of age and older. So all of this information can be found directly in the All County Information Notice, and I'm happy to drop the link into the chat as well once I'm done speaking. But I'll just go over the information on these slides. So on May 10th of 2021, the FDA approved the Pfizer vaccine for emergency use in children 12 years of age and older. Based on this approval and the CDC's updated recommendations, California has authorized the COVID-19 vaccination for children 12 years of age and older, as outlined in the vaccination plan. So that link is available there. The next slide, great. And so vaccinations are considered ordinary treatment, as we've kind of just discussed. So pursuant to Health and Safety Code section 1530.6 and Welfare Institution Code section 1651.57, 16519.57. Sorry, I should have got that clear in my head first. So it's important to recognize that licensed or approved foster caregivers and residential care providers, also including facility administrators and their designees, may consent to vaccinations for foster youth without a need for a court order. Also, as Karis had stated, it's really important to review all court orders for each youth to ensure that specific orders were not made regarding general medical care, vaccinations, or COVID-19 vaccinations specifically, which could require additional measures to be taken prior to the provision of a COVID-19 vaccine. Next slide, please. So it's important for caseworkers to engage caregivers, parents, and youth in discussions about the COVID-19 vaccine. It's also really valuable to include the foster care public health nurses who can provide critical health education regarding vaccination safety, efficacy, resources, and support the youth through the process. Vaccine discussions should also be a part of the child and family team meeting to ensure that youth, parents, caregivers, and other important supportive adults have the opportunity to work together to make decisions about the COVID-19 vaccine. Next slide. The last slide I have here for today is that it's important to remember that non-minor dependents have reached the legal age of majority, so they're over 18 years of age and older, and therefore have the legal decision-making authority as any other adult, including privacy regarding their medical conditions and the right to consent to receive treatment, including the ability to consent to COVID-19 vaccinations. So again, as I mentioned, I'll go ahead and drop the link into the chat, but this has been outlined clearly in our ACIN that I will just now link. And with that, I will turn it over to Jennifer Snar, who's going to go over some scenarios. So I'll turn that over to you, Jennifer.
Thank you, Ricky. Hi, everyone. Jennifer Snar. And we thought it would be helpful if we could kind of outline some specific scenarios that we've heard in our technical assistance emails and calls, as well as just some of the general scenarios that came up in discussion. So starting with the first scenario, what happens when the foster youth who is eligible for the vaccine does not want to take the vaccine? So the first kind of best practice suggestion that we have is to utilize a child and family team meeting, a CFT, or a similar team meeting to utilize that for a discussion about the appropriateness of the vaccine. In addition, there are limited vaccine mandates at this time, so the only time a youth's refusal would be an issue would be if the youth is in a situation where the vaccine is mandated, i.e. if it becomes required for the students in school and the youth is still in school. So for example, if you have a youth in LA County, that might trigger a discussion about whether or not the vaccine is appropriate in that situation. And then we want to point you to a couple of our WIC codes that directly speak to this. So WIC 16001.9A22 gives youth the right to participate in making decisions regarding their healthcare and treatment. And WIC code 16001.9A23 provides that youth shall be free of the administration of medication or chemical substances except in an emergency. Next slide, please. The next scenario is what happens if the caregiver wants the youth to be vaccinated, but the biological parent opposes. So caregivers are authorized to provide ordinary treatment, as we've heard, for youth in their care pursuant to 1530.6, and vaccinations are considered ordinary treatment. Parents can seek out a court order barring the provision of the COVID vaccine, or otherwise limit the resource parent's authority to seek out that ordinary treatment. And then once again, you can use a CFT or similar team meeting to discuss the appropriateness of the vaccination. That's going to start to sound quite familiar because we are really encouraging our caregivers, social workers, probation officers to utilize that CFT format or similar team meetings that you use in your area to help talk through whenever there's a conflict potentially. Next slide, please. The third scenario, what happens when the parent wants the youth vaccinated but the caregiver opposes? So again, we encourage the use of a CFT or similar meeting to have that discussion and talk through the possibilities. And then the law does not prohibit a youth from getting a vaccine in this scenario. However, there could be other considerations such as who's going to be the one that takes the youth for their vaccine, whether the caregiver is willing to have the youth back in the home, and their reasons for opposing the vaccination. Next slide, please. Scenario 4, so the other way around. The youth wants to be vaccinated, but the caregiver opposes. So probably starting to sound like a broken record now. Definitely encourage you to utilize CFTs or similar team meetings to talk through all of those possibilities. And then again, the law does not prohibit the youth from getting a vaccine in this scenario either. And again, there could be other considerations that come up, such as, again, who's taking the youth, whether the caregiver is willing to have the youth back, and their reasons. Next slide, I think. Yes, okay, so now I am passing the torch to Jennifer Messerschmidt, where she will talk a little bit more about vaccines related to education.
Hello, so as mentioned earlier, some local mandates are starting in school districts. The first one is now Los Angeles is requiring that all eligible youth are vaccinated by Monday, January 10th, 2022, unless exemptions apply. So now that this is starting, I know there's a lot of questions about vaccinations in schools. And so we'll talk about a vaccination scenario in schools to start. So what if schools mandate vaccinations? So the best thing to do is to first check your local school district's website for the most current COVID vaccine guidance in your area, because it's going to be different for every school's, what their mask policy is, what their vaccine policy is in your local school district. And the next thing to do would be, again, to have a child family team or similar team meeting. Utilize that to see if there's alternate education options that should be considered due to the local school district mandates. There may be other options for distance learning or homeschooling to continue. And then also always check with your foster youth services coordinating program or foster youth liaison program. May be a great resource to discuss what the vaccinations are that are required in your school district and to offer other supports. Always talk to also the foster youth social worker is there and can be contacted if the youth would benefit from mental health resources, if they're having anxiety, stress, or other concerns arising. And then you can also check out Senate Bill 277 that passed in 2015. It provides guidance regarding immunization requirements for children entering childcare or school. But keep in mind that since COVID vaccines are still new, that the SB 277 doesn't specifically address them. It's just an overall guide to immunizations in school. And so some additional school information that may be helpful. To find out more information about mask mandates, distance learning, and other school supports, please reference the Coronavirus Response and School Reopening Guidance that is available on the California Department of Education's website. And then for medical exemption information, in case a youth may have a medical exemption and you want more information on how to qualify or what may qualify for that, you can visit the webpage Shots for School here to get more information about the medical exemptions. All right, and that finishes up the education portion. And
All
so
right.
move into questions.
Thank you so much, Jennifer. And so it does look like we have time for some additional questions. We've already got several in the chat. Some of them may have been answered in this last part of the presentation, but we'll go ahead and try and go through most of them to make sure that you have clear answers and no further questions. Ricky, are you wanting to take over with asking questions?
Absolutely. So I actually want to invite folks that have a question that they've dropped in earlier that hasn't been answered to go ahead and re-enter if you're comfortable doing that. We're going to go through and scroll and make sure that we're getting the questions. But as Lori mentioned, some have been answered already through the presentation, or the doctors have been able to provide some good guidance. And so if there's a question that hasn't been answered and you feel that we miss it, feel free to drop it in. But with that, I'll go ahead and get started. I'll actually start with some of the newer questions first, and then we'll kind of work our way backwards. So the question is, what if after the CFT, people still have not changed their mind? So if a caregiver wants a child who is medically eligible to be vaccinated, can the child be vaccinated, or do we have to wait until the parent takes that issue to court and the court decides?
And I should have said this earlier. We invite anyone, any of our attorneys that are on today to jump in if they want to add something to the answers to some of these questions.
I'll read that one more time because I know it's a little bit of a longer question. So the question is, so what if after the CFT, people still have not changed their mind? So if a caregiver wants a child who is medically eligible to be vaccinated, can the child be vaccinated, or do we have to wait until the parent takes the issue to court and the court decides?
I think that we might need to unmute Roy Westfall. I think he has something to say.
I'm unmuted now. I didn't realize I could unmute myself, so sorry about that.
All right, go ahead, Roy.
If you are aware that the parent is objecting, I don't think you should run out and go get the youth vaccinated when there's still a disagreement. If you have a belief that they're going to be going to court. Now, that doesn't mean you have to wait 6 months because the parent keeps telling you they're going to go to court. But we all know filing something doesn't get done at 6 o'clock at night when the CFT is done. And it really is not an appropriate thing to then go to Rite Aid knowing that the parent in the next day or two is going to go file some type of an objection. So things need to be thought out in that type of a way, not just running out and doing that. But if the youth wants the vaccine, the caregiver wants the vaccine, the parents made their objection known, but hasn't done anything to make that objection kind of formalized, and they know that the caregiver wants the child to have the vaccination and the youth wants the vaccination and they're planning to get the vaccination, I don't think it's inappropriate a week later to go get it if nothing has been filed. But I wouldn't run out there the next day and go get it done.
I think we would also encourage our social workers and probation officers to engage their county councils in these discussions, to get some more assistance at the local level, right?
And this is Karis. I was just going to add in that question, I was just presented You could also put the youth in touch with their attorney regarding their legal rights, because the Bill of Rights does say they have a right to be free from medication. And so their attorney could give them advice on how best to make sure that is respected. I think we kept emphasizing the CFTs, because in that scenario where the caregiver wants the foster youth to be vaccinated, but they don't want to be vaccinated. Let's say, for example, the foster youth really does like that placement and they do want to, stay there. They don't want to have to go through a placement change during the pandemic. That's why we emphasize the CFT, because that might be an opportunity. Obviously I don't know the specifics of that situation, but let's say, it may be like an older caregiver or a caregiver who feels they're they may have an increased risk of getting COVID. If they've already been vaccinated, maybe a nurse or someone could explain that whether or not the youth is vaccinated, it won't affect their immunity. So, there's just a lot of different ways to sort of help resolve the disagreement. But at the end of the day, I do think it's important in that situation, to put the youth in touch with their attorney to make sure their rights are respected.
Thank you.
Great. So I'm going to go ahead and jump back to an earlier message, and then I'll come back to our more recent messages. So the question was asked earlier in the presentation of, has this caused more placement issues? And then, in other words, how are counties/agencies addressing situations in resource family foster homes where one child or adult is not vaccinated? Any tips for these situations?
So I'll jump in and at least tell you that we have received very few questions we have several, inboxes for different purposes, and we've only received a handful of questions about this scenario. Also in our meetings with our public health nurses, we aren't hearing a lot yet. I think it's kind of maybe a little bit early, but we're not hearing too many folks saying that a lot of placement disruptions are happening because of, the vaccination issue. But I welcome others who may have some more specific information from their county or their, local jurisdictions to chime in if they have other additional information. And feel free to put your information in the chat too, if you have more specifics about what's going on in your area.
Great. Lori, would you like me to move on to the next question, or do we?
Yeah, let's go ahead and move on to the next one. And then if we have somebody that wants to add more to that, we can go back to it.
Great. Okay. So the next question we have here is, does the youth's decision/choice to not get vaccinated trump the foster parent or bio parent's decision?
Any of our attorneys want to take that one?
I mean, yes, you can't force them to get the vaccination. Nobody is going to hold that youth down. And this is Roy with CDSS Legal. You can't hold them down and force them to get the vaccination absent some other type of court order.
Thanks, Roy.
Yeah, another question that is coming up is, if foster youth refuse the COVID-19 vaccine, are they excluded from school, or did they get a waiver?
This is Roy again. It's going to depend on the school's rules, and there's not a waiver for foster youth. That's not something that in general they just get a waiver. They'd have to seek out a medical exemption or what other types of exemptions that district is allowing.
Right. So as we talked about before, it's really important to go to your local school district's website. We checked several, and they had, the most specific and up-to-date information for their district. And we've also talked to our partners at California Department of Education, who said the same thing, that it's a district by district situation at this point.
Great. So the next question is, do we have an existing court case that might help us in figuring out a correct response to various objections or excuses?
If I'm remembering correctly, we did some research and we weren't able to find any similar case that would apply to the situation. Roy, am I remembering that correctly?
There's no case law associated with the Health and Safety Code 1530.6. And as far as I'm aware, the only mandate that we have in the state is from LA Unified School District as far as youth go. Somebody else can chime in and let me know if there's others. So you would have to look and see what their exemptions are, and see if the youth fall into one of those categories that they'd be allowed to get an exemption. There's always a medical exemption. The other things are going to be, are there religious exemptions? Are there personal belief exemptions? And maybe other types of exemptions I'm not aware of, but there will be a medical exemption, and you should check and see if the foster youth fall into that exemption for sure.
I'm also seeing a comment in the chat, which is a really good point. All foster youth are allowed to be enrolled in school without an immunization records. That is one of their rights. So regardless of whether it's another immunization or COVID might be something new that we're encountering. But I would highly recommend, if any child is being disallowed enrollment in a district that is starting to require a COVID vaccine, that they, speak with their attorney and their social worker and try and work it out at the local level.
Just for the sake of time, I'll go ahead and move on to the next question, which is, do foster parents and guardians have to be vaccinated now?
Not at this time. We have some CCL folks that might be on if they want to chime in with any additional information, but as far as I know, there are not requirements for our resource parents at this time.
I'm seeing another question here that says, does the youth, that's a duplicate. I'm so sorry. I'm seeing a lot of comments, which are wonderful. There's a comment here that I'll put voice to, which is FYI, Sacramento Public Health offers training regarding the COVID-19 vaccine to help debunk myths and address concerns. So if there's a link to that, that'd be great to drop in the chat. Otherwise, folks can poke around online to find that. I'm sure that's a great resource. There's another one here. It's more of a concern regarding non-vaccinated minors having possible exposure and what the protocol for quarantine is for them. Haven't come into many concerns regarding a child being vaccinated. That appears to be more of a comment. Anyone on my team, if you have a question loaded up as I scroll through that I have not gotten to, feel free to chime in.
I think another thing that's important to mention is for our social workers and probation officers and our resource parents, that it's always good to have conversations with the youth's physician, or to take them so that they can have conversations with their physician when they're having questions about the vaccine, but also about exposure and quarantine and things like that. I think, going straight to the experts in the medical field is always a good option in those situations.
I'm seeing a new question here that asks, can licensed residential facilities, STRTPs, mandate that staff get vaccine?
Do I have anybody from CCL on that can answer that? To my knowledge, I'm not certain of that. We can take that back if there's no one available to answer it right now and get back to everyone.
Can you all hear me?
Yes, we can.
I work for an STRTP and we have not yet been mandated to get vaccinated.
All right, thanks.
Perfect,
so
thank you.
Yeah, we'll check with our CCL partners and get a more complete answer out to everyone.
Right. There's a statement right here that may be a question, so I'll just put voice to it, which is, I would then think that if a minor is not vaccinated, then they would need to wear a mask in the school like any other unvaccinated person. Do we know if that is correct?
I believe that in California, the schools are having mask mandates when they're inside. So yes.
Again, I think one of the things that we've stated earlier in the webinar is making sure to check the local school districts, as the school districts have, seems to be that there's varying policies there. So it's always a good option to check with the local school district. Is anyone else on my team seeing unanswered questions at this point? Or if folks have any questions that are still outstanding, please, I invite you to drop them in to the chat so they're fresh for us.
Ricky, you caught all the ones that I had in my notes, so I think we're caught up for the most part, other than new questions coming in now.
Awesome.
I'm
So
seeing,
we'll
I'm seeing a
ask
question in there about homeless youth.
I think that
Or
actually, Lori, I think that was a comment that was that
Okay.
we had touched on earlier. That was just the information about homeless and foster youth are able to be enrolled without the vaccine
Okay,
status.
thank you.
So yeah, I did see that one, which was, thanks for whoever dropped that in the chat. That was really helpful information. Let's see, I scrolled past it. Yeah, okay, so the question is, can we get the recording to this webinar? Sorry, I should have prefaced that with, that's a logistical question. So do we yet know how this webinar may be disseminated?
We will provide the webinar slides via email with some additional information about next steps, because we do need to go through our steps to make sure that anything that we post is ADA compliant, and that takes a little bit of time. So more to come on where it will be posted.
Thanks, Lori.
There was, Ricky, a question that was mentioned earlier and then touched on again just now. Someone commented a while back, I think I heard earlier that only medical exemptions are allowed, but not any due to religious beliefs. And then I think we have a citation here that clarifies indeed that there's only a waiver for medical and not for religious or personal beliefs. Did I get that right? That's what it appears to be in chat.
Yeah, it appears there's a link there. So wonderful. Yeah, thanks for pointing that out. I know someone did ask earlier, I'm not sure if our CDPH doctors are still with us, but the question is, can doctors send out citations to the studies they cited in their presentations regarding efficacy of vaccines versus previous infection, benefits of the vaccine versus risks? Those may be helpful in CFTs when there are disagreements. So if, I'm not sure that they're still on the line here with us, but I think that that's something that we can follow up and see if they can provide us more information that we can send out with those slides, as Lori mentioned.
Yeah, we'll definitely follow up on that.
Did we already answer the question of what are the LAUSD's exceptions to vaccination requirements?
If I remember correctly, we don't, I'm not sure that we know, and we were referring folks to the school district.
Oh, the doctor actually answered that in the comments. I was the one who asked him because he had mentioned those. And so I thought, oh, maybe he knows. And so he mentioned it in the comment section.
Wonderful. Great. Well, maybe we can move on to the next slide then, which is our final slide that just includes information about follow-up questions and just any questions that you may have. So Lori, I can pass it back to you if you'd like.
All right. Well, again, just want to thank everyone for joining us. This was a long presentation, but loaded with hopefully a lot of helpful information. Going forward, as we said, we'll be sending out the materials. But if you have general COVID-related questions, the mailbox is cfsd@dss.ca.gov. We do have a special process for routing any COVID-related questions. We have folks that are checking those and routing them to the right branches and bureaus, et cetera. But if you have just general foster youth health and wellness questions, you can mail this inbox here, fosteryouthwellness@dss.ca.gov. And that's a mailbox that falls with my team, and we will get back to you, within 24 hours usually with any answers to your questions. So again, thank you. We'll be keeping all of this chat and going through it again and providing updates as appropriate, once we have a chance to filter through all of it. And we just thank you and continue to thank you for supporting our youth. This has been a particularly difficult time with the pandemic for all of us. And so thanks for your support and have a great afternoon.